Next up, we have loose associations. And for this thought process, one of the most simple way to understand it is through sequelae, right? So you have one disease process, which will necessarily lead into other disease processes. And then based on what the question is asking, you may be at a certain point in the sequelae, and they may ask you to go back and understand what was going on earlier, or they may ask you for future things, right? So for instance, or they may ask you how did this person get this specific presentation? So for instance, if you have strep pyogenes, a strep pyogenes infection causing strep throat, which goes untreated, right, you could develop rheumatic fever. If that goes untreated, you could also develop, if this person is not cared for properly, they could develop mitral stenosis. So they could give you this presentation, and they frequently do. They'll give you a presentation where someone has mitral stenosis, and they'll ask you, okay, how could this, what happened here? What caused this to occur? So they could ask you about the pathophysiology, they could ask you about how it could have been prevented, they could ask you what could you have done, or what they could also do is they could give you someone with mitral stenosis, and they could give you this because they know that you know this, and they'll try to trip you up and ask you about strep pyogenes when this person may only have age-related calcifications causing this mitral stenosis. And again, these things are different, but in terms of the presentation and in terms of what they give you on the exam, they may try to not trip you up, but they want to make sure that you understand that these things are distinct and different, so that if you have a patient who has a strep pyogenes infection from many decades ago or many years ago, right, that you know how to work them up, versus someone who is a little older in life and may have only age-related calcifications, how you work up that patient, right? So understanding how question writers try to go after these concepts is not only beneficial for helping you get more questions right, but ultimately so you can help more patients in real life and you can help them lead better and healthier lives.